Welcome back. Speaker Nancy Pelosi needs just a simple majority in the House to pass health care legislation. But this week, she faced a rebellion from the 52-member-strong coalition of conservative Democrats known as the Blue Dogs. Arkansas Representative Mike Ross is their leader. He joins us now from Capitol Hill. Congressman Ross, thank you for being with us. And let me start off by asking you, you met with Rahm Emanuel and Speaker Pelosi on Thursday for several hours. Did that session specifically advance health care consideration? Did you come away more or less optimistic?
Well, we spent about 3 hours on Thursday with Speaker Pelosi and Rahm Emanuel and Nancy Parle, the White House lead negotiator on health care, and 7 hours with Chairman Waxman the day before that, and 3 hours at the White House on, I guess, what was it, Tuesday, more than an hour with President Obama. And I'd like to think we're making progress. We're still talking, and that's a good thing.
When do you think a bill might pass your Commerce and Energy Committee?
You know, I'm not going to get into a box on these artificial deadlines. I think that's a mistake that's been made. Look, this is the most complex and complicated legislation that we've dealt with. I'll tell you this, we are closer now to getting health care reform done than at any other time in the history of this country. It's going to happen.
Congressman, I'm not going to try to pin you down to a specific date, but what I am trying to find is, can you get something through committee before you go home for the August recess?
Well, we continue to negotiate. You know, for 3 months now, I chair the Blue Dogs Health Care Task Force, and for 3 months now, we've been saying that the current House bill does not do enough to contain costs. We're trying to reach an agreement. We're all for health care reform. We just want to ensure the American people that we're squeezing every dime of savings that we possibly can out of the current health care system.
I'll come back to that cost savings in just a moment. Just a final question, though. Speaker Pelosi did say that she's considering a floor vote the end of next week, or possibly even keeping the House in session into the first week of August and having a floor vote. Would that be a mistake?
It would be, and I suspect that will not happen. You know, Mr. Reed's now indicated a Senate floor vote will not happen to September. So this is not all about us holding the bill up. They're not going to consider it in the Senate until September anyway, which, quite frankly, I think makes the argument that we've been making, that let's slow this thing down, let's make sure that we're getting it right, and let's give the members a chance to read the bill that they're going to be voting on, which is over 1,200 pages long as it stands right now. But I don't suspect there will be a floor vote in the House before the break. Quite frankly, I don't think they have the votes. It's not just the conservative Democrats, the 52 of us in the Blue Dog Coalition. It's much greater than that. We're speaking for the silent majority on the floor of the United States House of Representatives. I'm even surprised myself at the number of more liberal and more moderate members that have come up to me, and I think they're coming up to me to jump on me for slowing this thing down. Rather, they're thanking me for slowing it down. They think it's important that we take the time to do it right.
Let's go to the cost provisions you were talking about. The MedPAC provision, which you prodded Chairman Waxman to accept. Surgeons and specialists said the other day that it would have unintended consequences and that it would include restricting patients' access to specialty care services.
Well, this idea of an independent Medicare advisory council was actually President Obama's idea, and the director of the CBO said this would do more to contain cost, to get health care growing closer to the rate of inflation than anything else that we could do.
So you dismiss the concerns of the surgeons and specialists?
Look, change is hard, and I think it's premature for anybody to judge the concept when we're still trying to get on paper exactly how it would work. We're not talking about the traditional MedPAC thing here, and I understand there's a lot of reasons why traditional MedPAC scares providers. We're talking about something different, something more modern, something based on common sense that will work. I mean, currently what we have is broken.
Congressman, you have said that any public option is acceptable only as a backup if the private insurers fails. Does that legislation then, does any legislation have to explicitly have a trigger in it for that public option to take effect?
Well, you know, the position that the 52-member Blue Dog Coalition took, and it requires a 2/3 vote of our membership to take a position, we believe a public option should be there as a fallback option, much like we had in Medicare Part D. We believe that we need to demand serious reforms from the private health insurance companies. We need to remove pre-existing conditions. We need to remove waiting periods. There's a lot of reforms that we need from the health insurance companies in this country. We need to demand that they squeeze every dime of savings they can out of a very inefficient healthcare system.
Would you insist on a trigger in that provision?
That's our position. We believe a public option should be there to ensure the private insurance companies do right. If they don't, a trigger would be pulled, and then they would have that competition from the government.
Could you accept in paying for this either removing some of the tax deductibility for the highest cost or Cadillac health insurance plans, or taxing health insurers on those most costly plans?
I believe that what the American people want us to do is slow down, take the time to read these bills, and ensure that we have squeezed every dime that we can of savings out of the current healthcare system before we consider any new revenues. Once we've done that, I think the American people are prepared for us to then look to revenues. I think they believe it should be a shared sacrifice.
Well, if you get to that
every
point,
American will benefit with the proper health care reforms.
and if you get to that point, how about those proposals? Tax deductibility on the Cadillac plans, or taxing insurers on the most costly plans?
I think every idea has got to be on the table. But again, I don't believe we should get to the revenue side of this until we've assured the American people that we have effectively contained cost and reduced the high cost of health care and health insurance in this country.
Okay, final quick question. What are the odds that a health care bill will pass Congress this year?
Oh, I think it will. Look, I think we're closer than we've been since Harry Truman first tried to reform health care. And I really do believe that we will meet the President's goal of passing meaningful and substantive health care reform this year, and I want to be a part of doing that.
Congressman Mike Ross, the leader of the Blue Dogs in the House, thank you very much for being with us.